Hi, Professor Cooper. This is Olivia. I'm going to be filming my physical assessment with Rachel, my 14-year-old sister, and Thomas, who is going to be filming for me. So I'm just going to show you the room real quick. Okay, so I'm just going to give the phone to Thomas and I'll begin. Hi, my name's Olivia. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Rachel's is 11/18/2005.
Good. So today we're going to be doing the second half of your physical examination. I'm going to ask you a few questions and then I'm going to do the physical exam itself. Is that okay?
Yeah.
All right. It should take about 15 minutes. Do you have any questions or anything before we start?
No.
Okay, just so you know, everything between me and you stays confidential. And I'm just going to lock the bed before we begin. So can you tell me about how you're feeling today?
Pretty good.
Pretty good?
Yeah.
And can you tell me about how the coronavirus and quarantine has affected you?
It's just really school's out, that's it.
That's it?
Yeah.
Have you had any recent thoughts of hurting yourself or suicide?
No.
Okay, good. I'm going to have you hop up and I'm going to have you walk to and from your dresser. So I noticed that your movements are deliberate and coordinated, no ataxia or anything like that. And I'm going to have you do it one more time, except heel to toe as so. So I noticed that you're walking before, you had 15 inches in between steps, which was expected. You can turn seamlessly, your arm swing is bilateral. No problems with balance or anything like that, which is expected. So you can go ahead and sit back down. Your posture was erect, your position was relaxed. I didn't notice any slumping of the shoulders, which is expected. So nutritionally wise, I don't notice any signs of malnutrition, no cracked or dry lips, no brittle hair, anything like that. You're not obese and your weight is appropriate for your body type. Dress-wise, you're dressed appropriately for the situation, and hygiene-wise, your hair is clean, your body is clean, your nails are clean, you don't have any foul odors that we should discuss, so that's good. Behaviorally, you're speaking back and forth with me, you're conscious, you're verbalizing with me, which is expected, and your mood and affect, you told me that you're feeling good today, right?
Mm-hmm.
Okay. Cognitively, you already told me your name, so can you just tell me your where you are and what day it is?
It's Thursday, I'm in the doctor's office.
Okay. So you're awake, alert, oriented times 3. Thought processes, I assessed how you were thinking about the coronavirus and the quarantine. You had a logical response. You don't appear to have any thoughts of suicide. Your thoughts are clear, logical, you're not jumping in between sentences. So ABCT is in check. As you grow older, you might notice that you have a wider basic gait when you're walking, so you might have a little bit of slumping of your feet. You might drag your feet a little bit. You might have a wider stance like this. So, moving on to your neurological and musculoskeletal. Can you tell me about any problems that you have with activities like walking up and down the stairs or brushing your teeth?
I don't think I have any.
Okay. Can you tell me about your daily intake of calcium?
I drink lots of milk and vitamins.
Good, that's good for your bone health. And can you tell me about any pain or swelling in any joints that you have?
I've never experienced that, to be honest.
Okay, so looking at your skin overall and your joints, I don't notice any deformities. They're equal in size bilaterally. I don't see any swelling or masses or inflammation, redness, anything like that. So we're going to go ahead and start with Perla. So I'm going to have you look at the wall behind me and I'm going to shine a light in your eyes. Okay. So your pupils constricted concentrally. They went from about a 5 millimeter to a 3 millimeter, which is expected. I'm going to have you follow my pen light in with your eyes. Good, so your eyes converge on the axis, which means that you accommodated for my pen light. So your pupils are equal, round, reactive to light, and accommodation. Perla is in check, and your cranial nerve 3 is intact. So I'm just going to test your muscle strength of your upper extremities real quick. Can you just squeeze my hands as hard as you can? Good. And then I'm going to have you raise your arms and push against my push. Pull against my pull. And I'm going to do quick range of motion, so flexion, extension, circumduction, flexion, extension, circumduction. So I didn't notice any paresis or paralysis in either arm. It was strength was equal bilaterally. Your muscle tone was slightly resistant, which is expected, and you have full range of motion in both shoulders and elbows. So I'm going to have you also, moving on to your lower extremities, push against my hands, plantar flexion, as if you're pushing a gas pedal. Good. Now with dorsiflexion, you can kick up like you're kicking a soccer ball. Good. And then push against my push with your legs. And then push against my push up. Good. So again, equal strength bilaterally in your lower extremities. Your plantar flexion and dorsiflexion were in check. And I didn't notice any paresis or paralysis. So your range of motion while you were walking seemed fluid. Can you just stand up for me real quick? Can you flex your knee? Good. And flex your other knee. Good. You can sit back down. So flexion and extension in your lower extremities was good. I didn't notice any limitations, and I didn't see you in any pain or anything like that. So as you grow older, just so you know, you may experience something called a senile tremor, which is just when you shake a little bit. And it's really important to stay active and mobile when you get older, because you might become, immobile. You might have limitations in range of motion if you don't keep your joints working. So yeah, I'm going to move on to the respiratory system. So can you tell me a little bit about how many pillows you sleep with?
2.
Do you sleep with them side by side, or do you sleep with them on top of each other?
Side by side.
Okay. And can you tell me if you have any asthma?
No.
Have you ever been exposed to the coronavirus?
Yeah.
Do you have any symptoms?
Yeah.
What kind of symptoms?
Stuffy nose.
Have you ever been tested for it?
No.
Okay. Well, I'll tell the doctor about that. Maybe we can fit you in for testing today. So, looking at your skin, I don't notice any signs of cyanosis or hypoxia, which is expected. We don't want to see any signs of deoxygenation, which you don't have any signs of deoxygenation. Your skin is intact overall. Your chest wall is expanding equally. I don't notice any retractions or bulgings in your ribs. You're not using any accessory muscles, and you're not shallow or deep breathing. So I'm just going to go ahead and count your pulse real quick. Okay, good. So I was actually counting your respirations. You have 16 breaths per minute, which is expected because it's in the 12 to 20 expected range. And I don't notice any bradypnea or tachypnea, and you don't appear to be short of breath, so no dyspnea overall. So I'm just going to go ahead, I'm going to listen to your lungs. I'm going to have you turn and face that way. I'm going to start at the left apices of the lungs, listening between the mid-scapular line and the vertebral line, making sure to stay away from any bony areas. So I'm going to start here. Take a deep breath in and out when you feel my stethoscope. Okay, so after listening to all 9 points bilaterally, normally I would have her have a bare back, but since this is not a clinical setting, I would have, it's inappropriate to do that, so normally I'd be listening without closed. Your lungs were clear to auscultation bilaterally. I didn't hear any adventitious lung sounds like crackles, wheezing, rhonchi, or pleural friction rub. Mostly in the peripheral area, I heard you have vesicular sounds, which are when inspiration is more than expiration, but more towards the vertebral line where your bronchioles are. I heard more bronchovesicular sounds where inspiration is equal to expiration. So you can go ahead and turn around, and I'm going to listen to your chest on the front. So I'm going to start again at the left, midclavicular line right above the clavicles. Take a deep breath in and out. You can relax your shoulders. Okay, so again, your lungs were clear to auscultation. I didn't hear any adventitious lung sounds, no crackles, wheezing, rhonchi, or anything like that. So your lungs sound clear, they sound good. I heard mostly vesicular sounds, especially in the peripheral areas, so nothing of concern there. So as you grow older, most of the time your lung recoil is decreased because you have decreased expansion and decreased elasticity of the lungs. So you may find it harder to inspire and expire air. So you might have an increased residual volume. At this point, I'm going to show the room one more time, just a quick little mid-stop point. So just again, there's Thomas, me, okay, ceiling. Okay, so now while I have you in this position, I'm gonna go on with your cardiac assessment. So can you tell me about any chest pain that you've ever had? Okay. Can you tell me about any family of heart disease?
Usually my grandfather.
Okay, keep that in mind as you grow older. And can you tell me about any, how long does it take for you to get fatigued? How much activity?
Maybe 3 to 4 hours of work, yeah.
Okay, so it doesn't take you like 10 minutes, it doesn't take you walking up a flight of stairs?
Yeah.
Okay, that's good, that means your stamina is good. So looking at you, your skin overall, the chest skin is intact. You don't have any signs of pallor or anything like that, which indicates that your cardiac output and arterial sufficiency are good. So I'm going to first auscultate your point of maximal impulse, your apical impulse, for 1 full minute. So this is at the 5th intercostal space at the midclavicular line. So I'm going to have you sit up just a little bit. I'm going to Okay, so your heart rate was about 80 beats per minute, which is expected. It's between 60 and 100 beats per minute, which is good. Your rhythm was evenly tempered. I didn't notice any sinus arrhythmia, which is okay if it was occurring. That is an expected finding. And Your rate rhythm, I heard S1 and S2 very clearly. They were separate sounds. S2 was not split with inspiration or expiration. And I didn't hear any S3 or S4 sounds. So what I'm going to do now, I'm going to auscultate the 5 landmarks on your chest as well. So no bradypnea, no bradycardia, and no tachycardia. So I'm just going to auscultate the 5 landmarks real quick. I'm going to start at the aortic landmark at the second intercostal space, or you can hear the aortic valve close. The second intercostal space, pulmonic. You can hear the pulmonic valve close after systole. Third intercostal space is the Erb's point. Fourth intercostal space, or left to the mid-sternal border, is the tricuspid, or you can hear the tricuspid valve close. And the fifth intercostal space, midclavicular line, is where you can hear the mitral valve close. So I'm going to listen one more time, except at the bell. So again, aortic, pulmonic. This is where I can hear S2 happen the loudest. Erb's point. The tricuspid. And the mitral. These two are where you can hear S1 happen the loudest, so S1. So I didn't hear any murmurs, bruits, or any vascular, any turbulent blood flow or anything like that, so your heart is pumping healthy. There's nothing of concern. As you grow older, you might notice something called arteriosclerosis, or your doctor may talk to you about that. It's when your vessels harden up and narrow, and that can cause an increase in blood pressure. Although sometimes it can be concerning to distinguish, and hard to distinguish between regular blood pressure elevation in the older generation and hypertension. So that's just something to be aware about. Another thing I'm going to do is the peripheral vascular. So can you tell me about any cuts or sores that you've had on your legs that take a really long time to heal?
I think I only had one that took long.
Okay. And can you tell me about any family history of high cholesterol or anything like that?
I don't think anyone had any.
Okay. And can you tell me if you've ever had like really extremely cold hands or feet?
My feet get cold sometimes.
Okay. So what I'm going to do, I'm inspecting the skin. I'm sorry, before I do that, I'm going to talk to you about the AB indices. So the AB indices, ankle brachial indices, is when you take the blood pressure from the right arm, and then you take the blood pressure from the right ankle, and then you take the blood pressure from the left ankle, and then the left arm. And you take the highest blood pressure, the highest systolic blood pressure from the ankle, or either ankle, and then you take the highest systolic blood pressure from either arm. And so you're going to do ankle pressure over arm pressure. Generally, ankle pressure is going to be higher than arm pressure, and so that'll create a ratio of 1 or greater. Anything outside of that would probably indicate that you have coarctation of the aorta or a vascular disease that we should investigate. But looking at you overall, I see that your skin, there is no varicosities that are apparent, no spider veins, no telangiectasia, no hematomas or anything like that, and your skin is pale. There's no varicosities or venous patterns that I see. So looking at your arms, I'm going to take your arms like this, and I'm going to palpate for warmth. So the temperature of your arms is equal all the way down. It doesn't gradually change. There's no change in temperature. Feeling your skin, I feel that it's moist. There's no diaphoresis. There's no dryness or xerosis or anything like that. So I'm just going to take your pulse real quick. Okay, that's a 2+. I'm going to take your other radial pulse. That is also a 2+. So you have 2+ radial pulses bilaterally. Looking at your hands, I notice there's no signs of clubbing or anything like that, which is expected. You have good cardiac output and good oxygenation. Checking your capillary refill. Your capillaries refill within 2 seconds, just a little less than that, which is expected. Good. So moving on down to your lower extremities, I noticed that your legs are equal in size circumference, so there's no outside signs of edema or swelling. So feeling your legs, there's no lesions. I see that there's no cuts or scars. You're gradually changing temperature from warm to cold, which is expected. It should not be marked or sudden or anything like that. That is expected. So I'm just going to palpate your dorsalis pedis pulse. Your skin is moist, no diaphoresis, there's no excessive dryness. Your posterior tibial. Then again, your dorsalis pedis. And your posterior tibial. So you have 2+ bilaterally pulses on either leg. Checking your capillary refill. It refills within 2 seconds. Good cardiac output. Good. And then quickly checking for edema. I'm pressing my thumbs in and no indentation occurs, so you have 0 pitting edema, which is good. So as you grow older, what you might notice is that it's sometimes harder to find the dorsalis pedis pulse or the posterior tibial, but you should be able to find it in at least 1 foot. So if that ever occurs, it should be expected. However, if you aren't able to find it in both feet at the same time, that's something that you should talk to your doctor about. So lastly, I'm going to have you lay down. We're going to do your abdominal assessment. Can you tell me about your diet and what you eat on a daily basis?
Just normal, just healthy and off, you know.
Lots of fruits and veggies?
Yeah.
So can you tell me about how much water you intake?
About 5 water bottles a day.
Ooh, that's a lot. That's good. And can you tell me how often you go number 2?
About maybe once a day.
Once a day?
Yeah.
Okay, do you usually go by yourself or do you take any laxatives?
By myself.
Okay, good. So looking at the skin, I noticed that there's no signs of jaundice. I don't notice any masses or lesions, hernias that we should be concerned about, bulges, and it's symmetrical in all 4 quadrants. Looking at it from this side, the stomach is flat, not scaphoid or protuberant, which is expected. So I'm going to start with your auscultation. I'm going to listen to your bowel sounds, starting in the right lower quadrant. So I'm going to have you can rest your hands to the side. Right lower quadrant, where the ileocecal valve is. The right upper quadrant. The left upper quadrant. And the left lower quadrant. Bowel sounds, you did have bowel sounds in all 4 quadrants, which is expected. They were not regular, like your heart rate is, which is also expected. They were not absent, hyperactive, or hypoactive. So next I'm going to percuss a little bit. I'm going to hear what your belly sounds like. Oh, there's your stomach. So I heard tympany overall, which is what we should be finding. It means that air has risen to the top of your stomach, and that's what we're bouncing off of. I shouldn't be hearing any dullness other than if I would be percussing over your liver or if you had fluid in your stomach, which should be very concerning. So next I'm just going to check your skin turgor, your clavicle, your abdomen. Your skin did not tent and it recoiled pretty fast, which means that you're hydrated. Your colon is taking in all of the water that it needs to. You're being hydrated. Your electrolytes are good and everything. So lastly, I'm going to palpate your stomach. So I'm going to rest my hand here, and you're just going to let me know if you have any pain. So the right lower, right upper. Okay so far? Yeah. Left upper and left lower. So you didn't have any pain. I didn't feel any muscle guarding, muscle rigidity, involuntary guarding, or anything like that. I didn't feel any masses or lumps or lesions or anything, which is good. So you can go ahead and pop back up. As you get older, sometimes you might have problems with constipation, depending on how active you are, what kind of medications you take, and how much fiber you intake. So it's really important to stay active and know what kind of medications you're taking and any side effects. So overall, that concludes our physical examination. All of my findings matched up with what you told me. I didn't find any variances or anything concerning. So you're overall a very healthy girl. There's nothing to report to the doctor. Is there anything else that you would like to say before he comes in?
No.
Okay, I'm going to go document my findings and my examination. Thank you. Have a good day.
You too.
I'm going to gel out. And then I have to also scan the room one more time. Thank you, Thomas. Thank you, Rachel.